helping a lot. To you.
Well, thank you very much. Definitely the stadium is getting packed, and the majority of those who are in this stadium are the community health promoters from all parts of the country. 47 counties across the country are also part of those whom the president will be launching today, and I just want to engage some of them. They have been camping here all the way this week, trying to be part and parcel of this process. Let me just start quickly. Ma'am, tuambie jina lako ni nani na umetoka wapi na unatarajia nini ile siku ya leo? Nakushikia microphone.
Jina langu kwa majina ni Tofina Kalulu kutoka kaunti ya West Pokot. Tunatarajia leo kukutana na president kwa mambo ya community health, atusaidie katika hali na kimaisha.
Hii community health unajua ni nini? Venye unaelewa?
Unaelewa kama kusaidia watu kufanya usafi na watu kuchoka kwenda hospitali.
Na uko tayari kufanya hiyo kazi?
Niko tayari kufanya hiyo kazi sababu nimeanza kufundisha wamama wasijifungulie kwa nyumbani. Wajifungue hospitali, wapeleke watoto clinic na wasilishe watoto kwa chakula kabla hawajafika mwezi 6.
Asante sana. Wacha niongee na mama mwingine hapa karibia kidogo. Songa hivi ndio uonekane kwa TV. Hauna viatu yako vimepotelea wapi?
Viatu yangu nilitolewa huko, nikiingia huko kwa gate.
Kwa gate ile vita nyiko huko.
Ile kubwa. Nasido na kuweka na nimfurahi leo kwa kukuja leo celebrate kama mimi CTV promoters. Nashukuru president wetu, nashukuru hata deputy wake kwa kutusaidia atupatie kitu kidogo.
Okay. Na unatoka Kirinyaga na jina yako?
Jina yangu naitwa Joyce Wajiko Musiri. Mimi ni CTV karibu miaka 30.
Asante sana.
Hiyo kazi vizuri.
Asante. Let me move a little bit higher to some of I think there's some more ladies here. Majority of them are the ladies. Ma'am, tuambie jina lako. Mimi naitwa Emmanuel kutoka KTN News. Wewe unaitwa nani na unatoka kaunti gani na uko hapa kwa shughuli gani?
Amina. Wacha wewe ongea nini saidia.
Kuja basi uongee. Kuja uongee. Njoo uongee. Kabla ajipange. Anza na jina lako, unatoka wapi na shughuli yako ni gani leo?
Mimi ni Abdullahi kutoka Marsabit County. Nimekuja kuhudhuria hii sherehe CHV kutoka Marsabit County.
Changamoto nyingi ambazo mko nazo Marsabit County ni gani? Za kiafya.
Ni changamoto watu tunapata mawaidha juu ya kunywa maji mzuri, yani afya nzuri, kukula chakula nzuri na mambo yote.
Asante sana. Tuzungumze nawe kwa haraka kidogo. Anza na jina lako, utuambie unatoka kaunti gani na siku ya leo umejipanga vipi kwa sherehe ya leo?
Mimi naitwa Yusuf, natoka kaunti ya Marsabit. Tumealika kama CHVs tukuje tuhudhurie Kericho.
Na kama leo ni siku ya Mashujaa, je, ni shujaa yupi ambaye unamsherehekea zaidi kwa maisha yako?
Mashujaa ni wengi. Mimi binafsi yenyewe ni shujaa.
Yeah. Asante sana. So that is it from here in Kericho. It is muddy and I'm actually struggling to stand. That is the situation in the whole stadium. But we will be making it to ensure that you get the full picture of what is happening here in Kericho County. The Kericho Green Stadium, it is packed to capacity. The 10,000 people around the county and of course across the country who are here. And from the look of things, if the weather allows, we should be having this event closing earlier than the normal days because of the weather patterns where it rains a lot here. So that is what we have from here, and I'll be handing it back for more updates.
Other than now turning right.
Thank you so much, Tom. From the other end, we are still here at Mashujaa Day, bringing you up to date with what is happening. Today, we are launching the universal health coverage, where President William Ruto is expected to roll out the program across the country. And with me, I am joined by Dr. Elizabeth Wangia, who is the Director of Health Financing at Afya House. and she's the main person who has been trying to ensure that the health sector in the country is well financed. And maybe we begin with you. What are the gaps at the moment when it comes to the financing of the health sector in the country?
So thank you so much for that question, and we are quite excited to start with that health financing could be given a priority within this government as one of the 4 main agenda. So financing is quite key when it comes to service delivery, given that it's the one that actually drives service delivery. One of our main gaps within financing is a high dependence on donors. And if we are to move towards sustainability, we have to look at how can we domestically mobilize our resources for the sake of sustainability. So that is one of the major gaps. Another major gap comes around inefficiencies. Inefficiencies is actually a source of we lose a lot of resources through inefficiencies. So that is one of the gaps, and that's why if you look at our 4 main priorities, we really emphasize on digitization. That is one of the areas in which we will reduce inefficiencies.
Before we go to the new laws, when we start with Kenya is still lagging behind on the Abuja Declaration, where Kenya is still lagging behind on the Abuja Declaration, where every government should allocate at least 15% of their budget to healthcare. Where are we falling behind up to now since 2001?
Oh yeah, thank you so much. At times I think we beat ourselves so hard. As a country, we are currently at around 8% of Abuja Declaration when it comes to the government allocation to health as a percentage of the total government budget. However, we have been growing gradually over the years. There are some countries in Africa where they are even less than 2%. So as a country, I think we are doing well, but our main focus right now shouldn't be really Abuja Declaration. We should be looking at how much of resources are being allocated to health as a proportion of the gross domestic product. That means as you grow, as the economy grows, also the allocation to health must grow, and not just necessarily the budgets. So our focus will be that, and that's why even as we speak, we really want to look at how do we increase domestic resources for health. And that will be not only through government resources, but even through private-public partnerships, because that's still domestic resources for health. Things like innovative financing, those are domestic resources. So moving forward, we have a financing strategy that is really focusing on how do we increase domestic resources for health.
And maybe before we go and talk about the laws, let's talk about the new laws that we have in place. We have the social insurance fund, we have the digital health fund, we have hospital facilities improvement financing. How will that work, first of all, with the counties? We are trying to ring fence hospital funds to remain in hospitals, but yesterday I had the Council of Governors, Governor Mudomi saying that might be impossible a little bit.
So if I may just touch on the 2 acts right now, that are touching on health financing. For a long time, facilities have been collecting resources, but those resources are sent back to the central, the county revenue fund. Within the county revenue fund, these funds are usually allocated to many other things that are not health related, and that's why you find that sometimes counties don't really get to have the resources even to buy medicines or even to do their operations. But this facility improvement financing bill will come a long way in ensuring that the counties are able to, the health facilities are able to ring fence their resources. And that is actually a way of increasing domestic resources for health. Because if you're able to have, at times we look for resources outside, yet we have not optimized our internal resources. And that is the work of the facility improvement financing. When it comes to the Social Health Insurance Fund, the Social Health Insurance Act, it has 3 funds. The first fund will be a primary healthcare fund. We are moving away from input financing, where we are buying medicines and human resource. We want to go into paying for service, and that way a facility will be pushed to offer the service if they are to get the resources. Then we have the Social Health Insurance Fund. That and let me just go back. For the primary healthcare fund, it will be mainly government, publicly financed. But any other, we could have many other sources of the funds. Philanthropists like you, if you feel like you are rich enough, you can also contribute into the fund. Partners can also contribute into the fund. Then we have the Social Health Insurance Fund. The Social Health Insurance Fund is the only contributory fund amongst the three, where we are saying we need to get the informal sector. Within the population, 80% of the population are informal. So we are saying, can everyone contribute to the informal, to the Social Health Insurance Fund? And with that, that's where we are saying that the rich will pay for the poor. Not literally, but that is what insurance is all about. That those who are able pay for those who are not able. When those who are well pay for those who are sick. Like right now, I'm well. There is someone in the hospital. My insurance my contribution will pay for them. When say I fall sick, someone else will be working. So it's a matter of what you call cross subsidization. Yeah.
And maybe on the social insurance fund, we have three modalities: the critical care, the chronic, and the emergency.
Yes.
So they say that when I've depleted my social insurance fund, then the critical and the chronic one will be activated. Yes. How will that be? How will the transition be?
So what we promised Kenyans is that there will be seamless service delivery, right from the primary level to the secondary level to the critical level. So as it is, we are saying that first, for you to access the chronic, emergency, chronic and critical illness fund, you need to be a member of the social health insurance. That means once you deplete the benefits, whatever the limit of your benefit package, and it's not depleting the fund, it's depleting the limits given within the benefit package. For instance, if the benefit package within the social health insurance indicates that cancer, maybe it covers up to six cycles, and the doctor prescribes, say, 10 cycles, those extra 4 will be sourced from the chronic disease fund. And to the patient, they will not know what's happening, it will be back end. So that's how we are envisioning it. However, just a caveat, for the emergency fund, you won't need to be part of the social health insurance. We say that any person, according to the Constitution, all Kenyans are entitled to emergency care. And it won't matter whether you are a member of the social health insurance or not. You will be able to access the emergency care. And this means right from the point of the emergency, if it's, say, a road accident, to the stabilization point. Then thereafter, we can say, okay, post-stabilization, back to the social health insurance fund.
And the president said yesterday that those who are unable to pay, the government will cover for them. Yeah. How will that look like?
Let me just emphasize that is not a new thing. Any country or you cannot say that you have achieved universal health coverage if you don't focus on the people who are poor and vulnerable. We have the very old, we have the very poor, we have the orphans and vulnerable people with severe disability. We have been, as it is, we have been paying for households of that nature. So far, close to 1.2 million households are covered, those who are considered poor. But we are saying in this model, we will continue targeting them. In Kenya, it says that 40% of the population is actually poor. And this is around 5.2 million households. We are at only 1.2 million. So we are saying over time, we need to expand that and get all of the 5.2 million, and the government will pay for them. And that is all in the spirit of social protection and equity. Universal health coverage are 3 things. You have to look at access to services. You have to look at issues of equity, and you have to look at issues of financial protection, and all that putting in quality of services.
As we talk on equal access to healthcare, I'm asking how the premiums on the new social insurance authority look like. How the package look like?
So you have asked me 2 different questions. I'll start with though they are interrelated. So I'll start with the issue of the premiums. As it is right now, following the passing of the Act, we will need to come up with regulations. These regulations, we will guide on really how much will everyone pay. I know there's been discussions around 2.75%. That was based on NHIF, and through the discussions we had agreed on that. And probably after we get into, as we do the regulations and look at the benefit package, we will be able to say, is it still the same 2.75% or not? Because we need to know what we are offering Kenyans, how much will the services be. Over the last 4 months, we have been doing costing of healthcare services. We have done costing right from when a patient enters the facility to the time the patient exits the facility. What does it take to treat this patient? And with that, we'll be able to say, if you have malaria, the cost of malaria will be this, and that will determine the benefits package.
And maybe lastly, we've been trying the third attempt on UHC.
Yes.
From your view, do you think this time we have the right, we're going to achieve this?
Yes, I think that's a very good question, given that we know that there have been those 2 attempts. And for now, we are saying, how can we be more sustainable? And sustainability, we have seen for sure that investing in primary healthcare is the most cost-effective way of ensuring sustainability. You have heard of all the return of investment when it comes to primary healthcare. And we know that this time we are not only saying that we are focusing on health, but we are putting our money where it matters. If you look at the CHPs there, this has never happened. These are the foundation. So for me, given that we are really focusing on the base, we want people healthy. We don't want to wait for people in hospital to fall sick. We want to make sure they're healthy enough so that they're able to be productive and build this economy. So for me, this is not only important to the health sector, it's important to the entire economy of this country, because human capital is quite key when it comes to building the economy of a nation.
So you say a healthy nation is a wealthy nation?
Yes, a healthy nation is a wealthy nation.
And just to continue is that the government is begging on preventive care instead of curative care.
Yes.
And that's why they've introduced the CHPs, 100,000 of them. One CHP will be overseeing 100 households. That is too much for one CHP for sure. Maybe is there plans to roll out more?
No. Actually, what you need to realize is that 100 households are not too many, because they are not sick. This is someone who knows the household. They know who is pregnant. They know who has maybe a chronic disease. The frequency of the visits will be based mainly on the vulnerability, basically what you call the risk assessment. If someone has a healthy family, maybe they have toilets, they have water, the frequency of that visit will be less, but then they will have the contacts that in case of anything, they are able to reach them. But for those people who will call at risk, maybe a household has a pregnant mother, it has a child, then this household is visited more frequently. And remember, this is not a full-time job. Actually, we don't want it to seem like really medical care as such. We need them to have that trust with the CHP to be even able to tell them really what are their burning needs. And therefore, to me, 100 households are not many. Actually, they are quite few, because you are not seeing them every day, as I said.
Yes. You are a chief economist. You are the director of health finance at MOH.
Yes.
Don't you think that transitioning from NHIF to Social Health Authority is going to be cumbersome and expensive to Kenyans?
With every transition, you expect there to be some challenges. But as I said, as we work on the regulations, we will put in all measures. We will look at how to transition, the staff, how to transition the system, how to transition the data. We know that NHIF has debts, maybe with health providers. How do we handle each of those debts? And therefore we have given ourselves 1 year to come up with all that transition process. We know the Social Health Authority will mainly be digitized, and we will have to do what we call a staff establishment. Within the staff establishment, we should be able to say that for this institution, these are the number of staff that we need, and these are the skill sets we need. And if those skill sets if people within NHIF match those skill sets, then they will be guaranteed, absorption. But one thing that I can guarantee you is that with digitization, you have seen even with the banks, when we went into mobile money, when we went into mobile banking, ATMs, they even reduced their tellers.
Yeah.
When we went into like Cop Mtaani or something like that, you could go to the banks and not see any queues. So it's inevitable. People with digitization, we really have to reduce the human interface.
And maybe as we finish up, maybe with this rollout.
So just as you have already seen, to start with, we have the community health promoters. Each one of them has their household. They are well kitted. The kits are quite comprehensive. In fact, they look like a small dispensary.
Yeah.
So at least Kenyans should expect that they are CHP. We'll be visiting them, advising them on how to, preventive care and self-care, not just preventive care. If you are diabetic, if you are hypertensive, you don't have to go to a hospital to take your blood pressure. You can be taught how to do these things yourself so that you take control of your health. At the end of the day, we need to take control of our health.
Thank you so much. I've been speaking to Dr. Elizabeth Wangia. She is a Chief Economist and the Director of Health and Financing at Afya House, the Ministry of Health. She has been taking us through the modalities of implementing universal health coverage that is expected to be rolled out countrywide today. And now I want to hand you over to my colleague, Fathia Noor, who is here with me. Fathia, welcome. And Fathia will be taking you through what is happening today. To you, Fathia.
Right, of course, very interesting conversation there. Thank you, Beldin. Yes, we are still at Kericho Green Stadium, where the 60th Mashujaa Day is happening. Of course, this year's theme is universal healthcare coverage, and that is what Beldin has been talking about. But just to bring you up to date with some of the leaders who have arrived here so far, Cabinet Secretary for Health, that is Susan Nakumicha, has arrived already in the stadium. Also Interior CS, that is Professor arrived in the stadium. We've also seen some of the members of parliament here. We're also expecting some other leaders also coming in. Remember, the chief guest for this day, this Mashujaa Day, is Angola's president, João Lourenço. He is the one coming in. And of course, we're expecting more leaders to be coming in, of course. But as you can hear and as you can see, the stadium is packed. There is entertainment going on at the moment. But we're expecting President William Ruto at around 9 a.m. or 10 a.m. And once he comes, he'll be inspecting the guard of honor here. And after that, the event will officially begin. So, of course, as you can hear, the event is still buzzing with a lot of excitement from different people here in Kericho County. Remember, this is the first time this is happening in Kericho. It's happening in Kericho County, and this is the second county that is hosting a national event in the South Rift after Narok County. But also to bring you up to date, earlier on there was a bit of commotion and a near stampede to the entrances coming in, especially at Gate C. Around 6 people have actually been taken to the hospital due to that, and we'll be bringing you with the latest with regard to that. Now, Mashujaa Day was officially commemorated beginning of 2010, and this is of course after it changed from Kenyatta Day under the Constitution of 2010. Now, just to take you back a bit in history, Kenyatta Day, of course, started in 1958 and was to commemorate leaders or heroes of this nation, people who fought for independence in this country. In 1952, October 20th, Kenya was declared a state of emergency by the then British governor, that was Evelyn Baring. And of course, at that time, Kenyatta, among other leaders, were taken into custody. And among them were, of course, the Kapenguria Six, that is Bildad Kagia, Jomo Kenyatta, Paul Ngei, Achieng' Oneko, Kumbuka Rumba, and of course many more. They were detained, and of course this was with fighting for the independence of this country up until we got independence in 1963, and when Jomo Kenyatta of course became the country's Prime Minister and then also became the country's president a year. So of course this day is just to celebrate people who have been impacting the country in a positive way. So we are expecting approximately 150 people to be 50 heroes, actually 150 heroes to be part of the celebrations today, and that not only politically of course, but also people who've been impacting the country, whether it's economically, socially, and also through the environment. Yeah, so of course we'll be bringing you live coverage of what's happening here in Kericho Green Stadium. The capacity of the stadium is around 10,000, and so far we've seen the stadium actually being full, and there are actually more people outside the stadium as we speak. But of course we're still expecting more leaders to come in into the stadium. Of course, at the moment, as you can hear, there's entertainment going on from different bands here. We're also expecting some plays from different people just to talk about, of course, what the country has been doing. Remember, this year's theme of Mashujaa Day is a universal healthcare coverage, Afya Mashinani, or Afya Nyumbani rather, and of course that is to make sure that every Kenyan has access to healthcare in this country. And of course we've seen the community health promoters, and they'll be distributed in different parts of the country. That has been part of the conversation. And the 4 acts that was, of course, is now a law, was signed by President William Ruto yesterday at State House. And of course this is supposed to take care of people's needs when it comes to health financing and health infrastructure, and the easiest way people can be able to access healthcare in this country. But of course, this is the 60th Mashujaa Day happening here at Kericho County. The first time this county is holding these celebrations. Like I said earlier, we're still expecting more people coming in, especially leaders. So far, CS for Health, Susan Akumicha has arrived, and CS for Interior, Kithure Kindiki has arrived. Now this county, of course, is the tea capital of the country. It is known for its tea farming, and of course agriculture is the backbone of this nation. And in this particular county, we've seen there is tea, there is coffee, there is maize, and of course there's also horticulture. And it's one of the counties, of course, that is doing very well when it comes to economy. And yes, it is the first time that it's holding this event. For now, though, I want us to go to the entertainment and see what's happening on the entertainment side.
Wapi kelele Kericho wewe?